Hey everybody, my name is Ken Parson. I'm with Triangle Health Solutions, and the reason I'm doing this video is because I'm often asked by people who are turning 65 yet plan to continue working and have healthcare coverage at work, whether they should or are required to sign up for Medicare Part A, Part B, or both. And quite simply, it all depends on that person's specific situation. There are many variables that need to be considered carefully because there could be some long-term penalties and financial ramifications. While this video is not going to address Part D drug coverage because it's not actually part of original Medicare, there are also late enrollment penalty considerations to look out for there too. The first thing that I want to say is be careful about taking advice from someone that is neither educated nor certified in Medicare regulations. Confusion abounds with this federal program, folks, and yet everyone's brother, sister, colleague, etc. seems to think they know all the answers. I have frequent discussions with employers and HR people who deal with employees and retirees every day about these issues, and yet they admit that they're confused and don't know all the advice that is best to give on this. So original Medicare is broken up into two components, and here are the basics. Part A is the hospitalization piece of Medicare. If a person is paid into the program via payroll deduction for at least 40 quarters or 10 years, they receive Part A at no cost. It is free from that point on and hopefully will remain so. If that person's spouse paid into Medicare, but they did not, they still are covered. Now, if a person worked 30 to 39 quarters, the monthly cost for Part A is $240. If a person worked less than 30 quarters, they can still get Part A, but the cost is $437 monthly. Part B is coverage for doctor visits, specialists, outpatient procedures, ambulance, ER, etc. Part B is not tied to how many quarters a person worked or paid into the Medicare system. Virtually everyone pays a monthly premium for Part B, with the typical amount being $135.50 per month in 2019. However, if an individual or couple has a higher modified adjusted gross income, they will pay more for their Part B coverage. The first threshold for paying higher Part B costs starts for individuals that made over $85,000 per year and couples that made over $170,000 per year in modified adjusted gross income. For the very top earners, Part B cost can hit as much as $450.50 per month. Now that you know a little bit about Medicare Parts A and B, let's get to the question of whether you have to sign up for either or both when you turn 65, or whether you should. First, there is no requirement to sign up for either Part A or Part B when you turn 65. However, there are potential lifetime penalties that could be incurred if certain things are not done in a proper and timely manner. What's the appropriate time? Well, as far as the sign-up taking place, open enrollment for Medicare runs for 7 months for a newly eligible person. Those months include the 3 months prior to that person's birthday month, their birthday month, and the 3 months after their birthday month. So for example, my birthday month is May. Therefore, my open enrollment would be February through April, May, and then June through August. Now that's plenty of time to get this done and get the enrollment taken care of if that's what you've chosen to do. But if you miss this 7-month window, you can still sign up during what's called open enrollment, and that runs from January 1st to March 31st of any given year, with coverage beginning July 1st. Now, I would tell you that that's not the best timing on signing up for Medicare because you could potentially leave yourself without health care coverage for up to 6 months by doing it that way. The enrollment process is most easily done by going onto the Social Security website, which is ssa.gov, but can also be done by going into your local Social Security office. If a person has already begun to draw Social Security checks prior to age 65, they will be automatically enrolled in Parts A and B prior to their birthday month, and they would need to opt out of Part A and or B prior to the first day of their birthday month, which would be the first effective day of their Medicare coverage, if they choose not to accept the coverage at that time. In a couple minutes here, you're going to hear a few reasons why a person might choose to opt out. Okay, Part A. In most cases, a person should sign up for Part A hospitalization when they first become eligible at age 65. Since there is no cost in most cases, a person that is still working may benefit from having the extra coverage, depending upon the quality and structure of their current company group health plan. The company group health plan operates as their primary coverage if the company has 20 or more employees, so their Part A would end up supplementing their group coverage if a hospital stay was incurred. One major exception to this is if the person signing up for Medicare or looking at signing up is working for a company with less than 20 employees. In this case, Medicare is mandated to be the primary health coverage, and any group coverage would be secondary. What does that mean if you don't sign up for Part A and or Part B and you work for a company with less than 20 employees? It means that you have no primary healthcare coverage, and your group health plan would only pay a much smaller secondary amount. If you work for a company that employs less than 20 people, I recommend you sign up for Parts A and B as soon as you're eligible. Now, a major note of caution. If you're currently on a healthcare plan at work at a company with 20 or more employees where you contribute to an HSA, which is a health savings account, you should consider delaying enrolling in Part A. If you enroll in Part A, you may still take money out of your HSA while it lasts, but you cannot make any pre-tax contributions, which basically defeats the purpose. In this case, you would want to carefully evaluate the benefits of the current HSA plan without Part A versus getting Part A and utilizing a non-HSA group plan from your company if it's available. Part B is a little bit trickier. Because there is a cost to Part B, which is typically $135.50 a month, but potentially much more, careful consideration should be given as to whether to sign up for this. This is where a lot of confusion lies because there can be penalties imposed by Medicare if someone does not sign up for Part B during their 7-month enrollment period. If you sign up late for Medicare Part B, you will have to pay a late penalty premium every month for the rest of your life, along with your Part B premium. Your monthly Part B premium will go up 10% for each 12-month period that you could have had Medicare Part B but did not take it. But if you are on creditable health care coverage, example, group coverage at your job, you are not subject to those penalties. Your clock would not start ticking as far as the penalty until your group health care coverage at work has ended. Here are a few examples of why someone would decide to delay signing up for Part B. First one, they have good group coverage at work and they don't want to pay the monthly Part B premium on top of their current monthly contribution at work. This would probably apply to someone who has a relatively small contribution that they make towards their healthcare coverage. A second example, they have a spouse and or children that are on their plan at work, and it would be more costly if they went on to Medicare themselves and then had to put the spouse and the child onto private healthcare coverage. Another example could be that they're covered under their spouse's creditable coverage from his or her job, and they don't want to, again, pay that extra monthly Part B premium. As long as you can show proof from yours or your spouse's employer that you have had continuous creditable coverage up until the time you sign up for Part B, you are not liable for any Part B penalties. Another big note of caution, folks, COBRA or retiree coverage is not considered creditable coverage to delay the Part B premium penalty. The coverage must be from a current employer. I often talk to potential clients that try to crunch the numbers and compare going on COBRA for a year once they retire or continuing on some sort of retiree coverage versus signing up for Medicare and then getting a Medicare Advantage, Medicare Supplement, prescription drug plan, etc. Don't waste the time doing those calculations because COBRA and retiree coverage does not count as creditable coverage in the eyes of Medicare. When you do delay Parts A and B or just Part B due to creditable coverage, you will have up to 8 months after the termination of said coverage to get yourself enrolled in Medicare and sign up for additional coverages like Medicare Supplement, prescription drug plan, Medicare Advantage plan, if you so choose. So in summary, whether or not someone should enroll in Medicare if they plan to continue working depends on many factors. Everyone is different, so it's critical to get your guidance and advice from an expert in the field. Otherwise, there could be lifetime penalties and major medical expenditures that can have an adverse effect on a person's retirement planning. According to a Fidelity investment study that was done recently, a couple turning 65 now will spend an average of $288,000 on healthcare costs throughout their retirement. You don't want to add to that figure with avoidable mistakes. Now, I thought it might be helpful to include several real-life examples of clients I've worked with as an illustration of how different scenarios can be. The first example is Thomas, and these are not their real names. He's 66 years old, and he had been told prior to turning 65 that he should sign up for Medicare, so he did so. He had group coverage at work on just himself, but he didn't know enough about the Medicare rules, nor did his company's HR person to know what he should do or shouldn't do. So for the past year, in addition to paying almost $500 a month for his share of the contribution to his company group healthcare plan, he's been paying an additional $135.50 to Social Security for his Medicare Part B coverage. Thomas and I met, reviewed the different options that he had, and he ultimately was able to enroll in a private Medicare Advantage plan that had stronger coverage than his group plan and had zero monthly premium. He now pays the $135.50 for his Part B, but he pays nothing for his Part A, and he's saving almost $500 per month by not having to contribute to a group health plan. His company is also very happy because their share of the cost of his group health care plan has been eliminated as well. Steve recently retired from a state university at age 76 after being a professor for over 30 years. He and his wife, Mary, had enjoyed excellent group health care coverage at minimal cost while he was an active employee at the university. However, once he retired, only he would be receiving health care coverage through the university. They would have to figure out what to do for coverage for Mary. Now, because they both have had creditable coverage, they wisely had not signed up for Medicare Part B, dating all the way back over 11 years. The three of us met and determined that given Mary's health issues and Steve's solid financial situation, a Medicare supplement and prescription drug plan would be the best way to go. I got them set up with the proper forms to get filled out by the university to send to Social Security, verifying that they have had creditable coverage for the past 11 plus years, so there was no Part B premium penalty imposed on them. Steve and Mary are very well covered and at a cost they can live with. And the last example is Bill, who is just about to turn 65 and very recently found out that his job was being eliminated at work. As a result, his company healthcare coverage was going to be ending in just another 30 days. He asked me whether he should or was required to sign up for Medicare Part A and or Part B. At this point, his wife and son are still on his company group plan. Also, Bill has contacted multiple companies about new jobs, and there is one or two that look like they're very promising as far as hiring him. We had a long discussion about the possible scenarios, but he really has to see if he gets one of the new jobs and what their group coverage is like first. Presumably, he should sign up for Part A right away, although he has 3 more months to do so, based on his open enrollment period. But the critical piece to that is that he has to find out if his new company will be putting him into an HSA-type health plan. If so, as we now know, he would want to avoid or hold off on signing up for Part A because he would not be allowed to make any pre-tax contributions to the plan. These companies do have more than 20 employees. As long as Bill's new company does not have an HSA as the only healthcare option, his likely next move will be to enroll in that group healthcare plan as well as Medicare Part A. If an HSA turns out to be his best or only option at his new company, he will hold off on Part A. This gives him the security of having coverage for his wife and son, as well as having some secondary coverage on himself. So that's it, folks. I hope this has been really helpful for you. I know it's a bit of a lengthy video, but this really needed to, I needed to go into detail on this and make sure everything was understood. My name is Ken Parson. I'm a licensed Medicare healthcare broker and a licensed agent with multiple carriers for all Medicare products, which gives me the ability to shop for you. If I can be of any further assistance to you, please don't hesitate to contact me. There's no cost and there's no obligation. And if it ends up that we do any sort of business together, all compensation is generated by the insurance carriers. So you have no commitment there. I want to thank you for taking the time to watch this video. Again, I hope it has been helpful. My name is Ken Parson. My cell is 919-667-6896. Again, my cell is 919-667-6896. My email is kbgparson2 and that's the number 2 at gmail.com. Again, K, B as in boy, G as in girl, Parson, the number 2 at gmail.com. And our website is trianglehealthsolutions.com. Thank you for watching and have a blessed day.